Hello, this is Kim Jong-il. Today, we will discuss how to make the torque control arch wire. When palatally displaced teeth are aligned, the clinical crown length appears short from the front, and the palatal gingival margin is not smooth from the occlusal view because it is located more palatally. This means that, although the crown moved labially, the root is still located palatally. Therefore, torque control is required for root labial movement. Many orthodontists use torquing spring or Warren spring for torque control. The arch wire we mainly use is 016 Orsu 22SS. If Warren spring is located at the incisal side on Aero 16X 022SS wire, as in the picture, the crown moves palatally and the root moves labially. However, the effect of Warren spring falls if continuous arch wire is connected to the adjacent teeth central incisor and canine. Let's compare the tooth movement on continuous arch wire and the individual tooth movement on torque control arch wire with L-loops. As shown in the picture above, when a wire with crown labial torque is inserted, the crown moves labially and the root moves palatally. On the other hand, if a wire with crown lingual torque is inserted, the crown moves palatally and the root moves labially. In torque control arch wire, crown lingual torque is applied only on the lateral incisor as in the photo. Typically, root labial movement takes a long time, so caution has to be taken from when the bracket is attached. For a palatally displaced tooth, the SWA bracket has to be attached upside down so that the dot is located at mesio-incisal side. After alignment, torque control arch wire is inserted. In torque control arch wire, 0 degree on the upper incisors, -7 degrees behind the canines, and separate -7 degrees on the lateral incisor are applied. In Figure A, crown labial torque is applied to the arch wire. Due to the crown labial torque, the loop is inclined in accordance with the contour of the alveolar bone, so it is less uncomfortable as the lip is not pressed. On the other hand, in Figure B, crown lingual torque is applied to the arch wire. The patient will feel discomfort because the loop presses on the lip. Crown lingual torque is applied to the arch wire, as in Figure B. But L-loop has to be inclined according to the contour of the alveolar bone, as in Figure A, so that the patient does not feel uncomfortable. To make this wire a half length of EO16 022 SS arch wire, Kim plier, tweed plier, arch turret, and marking pencil are needed. Turret has 5 grooves. Place the wire in the 0 degree marked groove and turn the turret. Turn left and right 3 o'clock and 9 o'clock to create an arch form as in the photo. Grab the center of the arch form with tweed plier and check if the wire passes through the center of the plier, as in the photo. Passing through the center means 0 degree. Make a mark on the wire between the central and lateral incisors and bend in the gingival direction. As shown in the photo, the bend forms a right angle from the side and 7 degrees or 10 degrees inward from the front. It can be confusing at first. It is divergent when viewed from the front. What does this mean? It means that the arch wire is twisted and torque is applied. Let's think about torque. Like this, when the wire passes through the center of the plier, it means 0 degree torque. If wire is inserted in the maxilla, as in B, what torque is applied? The teeth move in this way along the arch. In other words, crown labial torque is applied. On the contrary, if a wire such as C is inserted, what torque will it enter? The tooth is moved along this line. In other words, crown lingual torque is entered. When the wire with crown labial torque is held with a plier, the posterior part of the wire tilts upward compared to 0 degrees. On the other hand, when the wire with crown lingual torque is held with a plier, the posterior part of the wire tilts downward compared to 0 degree. When loops are made on torqued wire, the direction of the loops must first be considered. In general, torque control arch wire is used in the upper arch. Which direction do the loops face in the maxilla? It is important to remember that the loops should be directed gingivally, or upward, in the maxilla. At this time, when the center of the wire is held with a plier, the posterior part of the wire can tilt either upward or downward. As in Figure A, if the posterior part of the wire tilts upward, it means the same direction with the loops. If the loops and the posterior part of the wire are in the same direction, it indicates crown labial torque. Conversely, as in Figure C, if the posterior part of the wire tilts downward, it means the opposite direction with the loops and indicates crown lingual torque. Let's review again. Torque control. Arch wire with crown lingual. Torque should be made in a way that does not cause discomfort to the patient. Crown lingual torque is applied while making the loop inclined along the contour of the alveolar bone. At this time, hold behind the loop with plier and twist in the direction as shown in the picture. When the first loop is made, hold the rear part and adjust so that it does not press against the gingiva. Now, the loop is in the upward direction, and the rear part of the wire is directed downward like this. This is crown lingual torque. The second loop is similarly made to be inclined along the alveolar bone contour, and crown lingual torque is applied. Apply crown lingual torque to the loops on the opposite side, using 2 tweed pliers in the same way. After it is completed, the loop with crown lingual torque is directed upward, and the posterior part of the wire is directed downward. This torque control arch wire is mainly used in the upper arch. Turret is used to form a 0-degree arch on the anterior teeth. Make a mark between the central and lateral incisors. Form an L loop in gingival direction, and then apply -7 degrees of root labial torque crown lingual torque. Behind the canine as well, -7 degrees root labial torque crown lingual torque is applied. So when a palatally displaced upper lateral incisor is aligned and the clinical crown is short, keep in mind that torque control arch wire should be used for finishing. Another thing to remember is that since root labial movement requires a long time, SWA bracket should be attached upside down on the palatally displaced tooth. That is, attach the bracket so that the dot is located on the mesio-incisal side. In this way, -8 degrees crown lingual torque, or root labial torque, is applied. It is advisable to maintain the torque control arch wire for at least 6 months. Mesiodistal tooth movement is relatively easy. But buccolingual tooth movement, especially root labial movement of the palatally displaced upper lateral incisor, takes a long time. So maintain the torque control arch wire for about 6 months. Meanwhile, root labial movement of the upper lateral incisor is taking place by the use of torque control arch wire after the alignment of anterior teeth. Open coil spring can be used on the posterior teeth if there is any posterior crowding. After the lateral incisor is moved into the correct position with the use of torque control arch wire, MEAW with an additional loop between the central and lateral incisors is used for finishing. In non-extraction treatment, basic MEAW has 5 L loops on each side, but in this case there are 6. When torque control arch wire is used, the precautions are as follows. First, torque control begins when the bracket is attached. This means attaching the SWA bracket upside down. Second, after alignment, torque control arch wire is used. Third, since it is difficult to tightly ligate when torque control arch wire is first inserted, it has to be tightly religated in every patient visit. Fourth, keep the torque control arch wire for 6 months. Fifth, open coil spring can be used on the torque control arch wire to resolve posterior crowding. Sixth, in MEAW, a loop can be added between the central and lateral incisors. Lastly, after root labial movement with torque control arch wire, bonding retainer must be used for retention. Thank you for watching.